Hello and welcome to Triage, timely conversations for healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Thanks for joining us today. I am Alexa Sengupta, a healthcare associate in the Nashville office of K&L Gates. And I'm joined today by my colleague, Steve Pine, a health law partner based out of the Research Triangle Park office. And I will let Steve kick us off.
Thanks, Alexa. Really excited to be here and talking today about ESG issues in the healthcare industry. And I think this is a fascinating area to explore because it's a topic that holds tremendous potential for good. And the healthcare industry as a whole has always historically been a mission-driven enterprise that has focused on the improvement of the human condition through improving health and saving lives across communities. So on the one hand, this is an industry in the healthcare industry that perhaps has a leg up on most other industries and is particularly well suited to address ESG issues. And at the same time, health systems are frequently pillars of their communities, often being one of the largest employers in an area, and can really be a force for change. And ultimately, I think there are a lot of interesting ideas that can be unpacked in this area of the intersection of healthcare and ESG. But today, Alexa and I are going to be focusing on how these ESG issues, and in particular concerns about improving health equity, are increasingly being tied by CMS into healthcare reimbursement, particularly in the move away from fee-for-service and towards value-based payments. And really in the past decade or so, the focus on value-based payments has had several aims, where the idea has been creating incentives for providers that tie to and drive greater quality of care, improved health outcomes, and cost reductions across healthcare systems. But now we are seeing those aims expand and also include, as a key component, the idea of improving health equity. So Alexa, health equity has really been a focus of the Biden administration, hasn't it?
It has, Steve. So one of the ways we've seen some of these issues really come into focus as of late is through the Biden administration's focus on health equity. President Biden issued an executive order in January of 2021 titled Advancing Racial Equity and Support for Underserved Communities Through the Federal Government. In short, the executive order really signaled the administration's intent, among other things, to advance healthcare equity and racial justice by minimizing the influence of the social determinants of health. The executive order mobilized around 90 federal agencies and 50 independent agencies to evaluate and implement action plans to hopefully reduce some of these systemic barriers to access. And in response to this, both HHS and CMS published respective plans and frameworks, which I think Steve is going to talk a little bit more about.
That's right. And CMS has certainly moved forward accordingly to the White House aims. And while issues of improving health equity aren't new to CMS by any means, we've seen now that just in the past month, CMS has published its framework for health equity, which provides its key priorities for the next decade, which are right in line with the Biden administration's directive. These include expanding the collection, reporting, and analysis of standardized data as it relates to demographic data and social determinants of health, locating and addressing causes of disparities in health equity in CMS programs, building the capacity of health organizations to reduce health disparities, advancing language access, health literacy, and culturally tailored services, and increasing access to healthcare services and coverage. And so these are division-wide priorities. We're already seeing their influence take effect in a number of initiatives, including how the Centers for Medicare and Medicaid Innovation is evolving its value-based models around health equity and ESG issues. Alexa, could you talk a little bit more about that?
Sure. So like you were saying, we're now seeing issues and programs implemented on the ground that incorporate health equity and governance, one of which came about through the Center for Medicare and Medicaid Innovation, or CMMI, which published a white paper focusing on a large strategy refresh. The CMMI strategy refresh really laid out a plethora of objectives, including driving accountable care, supporting innovation, addressing affordability, and Also, not just advancing, but actually embedding health equity into every aspect of the CMS Innovation Center models. As a part of reaching the goals set out in the strategy refresh, CMMI, along with CMS, developed and unveiled the ACO REACH program in February of this year. The ACO REACH program is a new payment model related to Medicare and accountable care organizations. It replaces the previous GPDC model in an attempt to focus on health equity and better align with the priorities of the Biden administration, which we talked about. Some of the ways that ACO REACH implements this new focus on health equity is through requirements, such as requiring each ACO to specifically develop a health equity plan, identifying disparities in the ACO's market, and discussing specific actions that the ACO will take to mitigate those. Similarly, ACO REACH will place new data collection requirements and benchmarking adjustments that are focused around gathering demographic and social needs data in the hopes that tracking, reporting, and achieving certain measures will advance the delivery of care in these underserved communities. Lastly, the ACO REACH model really takes into consideration the governance aspect of health equity and ESG generally in setting out specific requirements for participating providers' governing body. One of which is that participating providers are required to have controlling voting rights over the ACO's governing board, and they must specifically hold at least 75% of the governing board voting rights. This is a pretty significant change if you think about the previous GPDC model, which only required providers to hold 25% of the voting rights. The governance requirements go even further by changing the rules related to the actual makeup of the board and how much control non-provider entities may have over the ACO, all in hopes of addressing health equity and ESG issues in the space generally.
Yeah, and these ESG and health equity issues aren't limited just to these CMMI models either. We can look, for example, to the proposed 2023 inpatient prospective payment rule, which was issued on May 10th of this year, to see where CMS is both requesting comments and implementing policies concerning environmental and health equity issues, some of which will take effect next year. On the environmental side, CMS is looking at and requesting comment about how it can support providers in determining likely climate impacts on their patients and residents in their communities. For example, caused by climate-related disasters or chronic disease issues resulting from climate change. Also, CMS is looking to understand what are the exceptional threats that climate-related emergencies present due to issues like storms, wildfires, floods, or extreme heat. CMS is further looking into how healthcare organizations could track and reduce their own climate emissions. Accordingly, CMS is requesting comments, for example, on how providers currently conduct climate risk assessments, how they measure performance on climate responses, how they plan for climate-related events, the role hospital leadership plays in the process, and several other issues. On the health equity side, CMS has laid out and is requesting comments on a proposed approach moving forward to identify, measure, and address disparities in care. So this includes requesting comment concerning several principles CMS lays out in the IPPS rule about how it will collect demographic data and data on social determinants of health, about what types of quality measures should be used to evaluate health systems in these areas, about the types of social risk factors CMS should be concerned about how to identify and evaluate meaningful differences in performance among providers, and about how such results should be reported. And even more immediately, CMS is proposing a series of quality measures, for example, in connection with the Hospital Inpatient Quality Reporting Program, or the IQR program, that are specifically targeted at health equity issues. So within the IQR program, CMS proposes to include a hospital commitment to health equity quality measure that, to meet that measure, would require hospitals to certify that they are making health equity a hospital strategic priority, that they're collecting demographic and social determinants of health data, that they're stratifying performance indicators to identify equity gaps, that they're engaging in quality improvement activities focused on reducing health disparities, and that they're engaging leadership to review strategic plans and review performance related to achieving health equity. Similarly, the IQR program will also include 2 measures related to screening for social drivers of health, including domains such as screening for food insecurity, housing instability, transportation needs, utility difficulties, and interpersonal safety. And this trend of incorporating health equity into quality measures isn't limited on the provider side either. CMS has also focused on similar issues about how to collect and evaluate demographic and social risk factors among payers as well, including payers offering plans on insurance marketplaces and Medicare Advantage plans. So all to say, there's a great opportunity right now for providers and plans to look at these topics and advocate to CMS about how it should be approaching and addressing these issues of health equity and ESG. And I should mention, while the opportunity to engage with CMS on this topic will be continuing, comments on the IPPS rule in particular are due by June 17th of this year. So, Alexa, I think we're really still at the early stages of this discussion, and there's a lot more to come. But at the same time, CMS is definitely moving forward with these proposals.
Definitely. And thanks so much, everyone, for tuning in and listening today. And we will see you next time.
Thanks again for listening to Triage, timely conversations for healthcare professionals. New episodes are available for download through Apple Podcasts, Google Podcasts, and Spotify. By subscribing to Triage, you will receive timely notifications for each new episode. Also, if you have any topics you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.